I'm going to give you a little bit of an overview of what's happened in the cervical screening program in England. I'm going to start more broadly to let you know that screening services were formally paused in Scotland, Wales, and Northern Ireland in March 2020. In England, it wasn't ever formally, but it was effectively paused because invitations were not sent out from any screening hub, and this includes breast, bowel, and cervical screening. However, many screening units recovered quite quickly and started sending out invitations again in July. In a letter dated the 31st of July to NHS Trust, the NHS Chief Executive, Sir Simon Stevens, set out his priorities for the rest of 2020 and 2021, and he made the restart of screening info a top priority, and he wanted this done by August 2020. So that's the situation. What's actually happened with cervical screening? And I will say that my talk in the morning was pretty much based on a publicly available document. And I'm much more comfortable in this subject this afternoon, but most of it I've gathered through speaking with the people who actually run and quality assure the screening program rather than any official evidence. But it seems that in England, invitations for cervical screening were suspended between the beginning of April 2020 and the beginning of June 2020. On the resumption of invitations in June, primary care providers, so general practitioners who are in charge of providing the screen to women, were given the option of continuing to delay those invitations for up to 6 months if they thought it was necessary to allow them to restart their services, because all primary care was severely disrupted in the first wave of COVID. So when the program started sending out invitations in June, they did stratify those invitations so that the first women to receive them were those who were on early recall. And this means that their previous test had not been normal and that they needed to be seen at a shorter interval that is usually recommended. And in England, that would be in less than 3 years if you're under 50, or in less than 5 years if you're age 50 to 64. So they got invited first. Thereafter, routine recall women, that means women whose last test was negative, were sent out their invitations. So effectively, this means that around August, both women who were affected by the COVID situation and those that would have been invited from June onwards anyway, were invited for screening, which essentially means that the program was invited a much larger number of women than they would have done the previous year. Now, my understanding from listening to those who run the program is that disruptions in secondary care were much less striking. Apparently, the disruption at colposcopy to referrals for high-grade disease was very, very limited, because the guidelines immediately, as soon as the pandemic shut down services, were that these women who will be at very high risk of cancer should be seen first, and that clinics should delay those referrals due to low-grade disease. And most of those were delayed for around 3 months. I understand that the majority of clinics in England have also managed to get on top of those delayed referrals. So at a program level, the program seems to have got itself back on track. But what is the real impact of the disruption? So roughly, I estimate that about 750,000 women were affected over those 3 months of disruption. So officially it was April to June, but the figures show that a decrease in samples received at laboratory from mid-March. So before it was officially stopped, which suggests that women's confidence had decreased at that point. Now, there is only data up to the end of August, and that suggests that samples received at the laboratory are getting close to the level we would have expected from previous year's data. But obviously, for the program to completely recover, we would expect that to be way above what we saw last year. But estimating the impact is actually quite complicated, because in 2019, there was a public awareness campaign exactly on the same months as the disruption. And I'm showing you a graph here, which shows you that that did lead to more women attending screening. And therefore, 2019 is not really a good baseline year. And also on a backdrop of falling coverage, it's difficult to know exactly how many samples we should expect. And additionally, HPV primary testing is just being rolled out across the country. So although on the face of it, invitations are back up and running, and perhaps I should have mentioned that England has a call recall organized screening program. However, I think the biggest challenge in estimating the impact will be what I call the consumer. So will women have the confidence to attend when they're invited, and also the providers? So can primary care practitioners provide the services they need to really get on top of the delayed screening? Thank you very much.